if you're never going through life being challenged, if you're just always like in your confidence and you think like you're pissing excellence all day and there's nothing wrong with you, like, you're never going to have the opportunity to evolve yourself.
Welcome to Fem MD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's guest is Dr. Mel Thacker. She's a double board certified otolaryngologist and lifestyle medicine specialist. She's a professionally certified coach specializing in surgeon coaching, and she's actually been my coach. I'm so excited to talk with her today about a litany of things, including the dark surgeon psyche. Let's dive in. Well, Mel, we are so excited to have you on the show today. I want to start big, dive deep. I think that it takes kind of a unique individual to physically cut someone open or, be invasive towards another human when they're, still alive. Do you find that there are certain personalities that tend to gravitate towards surgery, or what makes it to where we as humans can do that to another human?
I don't think a lot of people have thought about that before they got into surgery. What I'm noticing more than anything is that most of my clients are so intelligent and so external validation driven that like you end up at the top of your class in medical school and you're in AOA. And then you have this panoply of options for specialties that are highly competitive. And so you have dermatology or orthopedic surgery or urology or ENT or, what are the other plastic surgery? Yeah. And so like, they have to decide like, which one of these do I do? There was one person in the top of my class. I think there were two actually. One went into family medicine, one went into pediatrics. The rest of us went into these highly competitive specialties, which are surgical subspecialties. So I don't think anybody really knows what they're getting into. I think they just want to be the best.
That's so interesting. And I think that with so many fields, like one of my good friends is a nurse and we get to work together a lot of days, which is super fun. And we joke because she said like she distinctly remembers one day of nursing school. They were teaching her how to change the sheets in a bed with someone still in the bed. And she was like, why the hell are these motherfuckers not getting out of bed? And we laugh because then she went on to become an ICU nurse, which again shows like as students, when you go into nursing school, you really have like no clue that the majority of people that are taken care of as an ICU nurse are literally intubated in bed, and the day-to-day things that you're doing, like giving medications, changing the sheets with them in there. I think that is such the perfect example of, we have no clue what we're getting into when we decide to do surgery. So you mentioned that there are some high achievers that tend to gravitate towards surgery. How does that then play out during training?
So, I mean, it's like the whole adage of like see one, do one, teach one. And so those people who are the quick starts or the ones who learn very quickly and can kind of get their hands in there tend to really do very well. And you're right. Like it, as you said, like cutting people is very weird. So we learn quickly to kind of deny ourselves and extract ourselves from the equation so that we can become these robotic, homogenous, standardized things that can do a job well. And because we're so good at doing the thing for the external validation, the accolades, the gold star, the A+, we can extract ourselves from the equation. And so that's what most people do. They just take themselves out. Like my bodily signals don't matter. My opinion doesn't matter. Who I am does not matter. I just have to be like XYZ mentor, XYZ attending. And I just have to emulate them and become them. So then when we finish and we're like, okay, now I'm done. Who am I? Most people have no clue who they are. And a lot of them are psychologically and developmentally frozen as children. So you can develop academically, you can develop professionally, but you can't develop all of those ways unless you're conscious and deliberate about making sure you develop in all areas of your life. And so the majority of them are psychological children. They have really horrible self-talk. They beat themselves up. They're perfectionists, and they're still really relying on the external validation. But instead of having the gold star or getting the accolades or getting the nice words, the praise from the attending, now you're getting Google reviews from patients, you're getting good patient results, you're getting money. And that replaces your external validator.
When we talk, you say things like this, and I'm like, of course, like that makes total sense. But it's something I never considered, especially in residency, fellowship, and then like my early career as an independent surgeon, especially the like dehumanization of surgical training, like to the very most basic aspects of like not even eating, not drinking, not peeing. You almost learn to like ignore yourself during surgical training. And then I'm sure this is a theme you have with a lot of your clients, kind of trying to rehumanize yourself in your 30s.
Yes. And it's funny because it's like, who are you even? After all this time of extracting yourself from being there, you're not even present. Like your opinion doesn't matter, your body doesn't matter. It doesn't matter that you have to pee or that you're hungry. It becomes irrelevant. And so this is different than repression. Like suppression, when it becomes automatic, repression becomes automatic, it becomes suppression. And so you start to do that automatically with everything. You're like, oh, my body tells me I'm hungry, I don't listen to my hunger signals. My body tells me I have to pee, I don't listen to that. So everything that comes from within you, you don't listen to. You just you get so used to ignoring who you are that you don't even know who you are anymore. You have no relationship with yourself.
Yeah, and I would say that one of our other co-founders, Frances May Harden, she talks about forgetting a lot of like the time periods during training. And I very much like feel that now. Again, it's not something I really intentionally thought about until, several years out. Do you find that a lot of people during that phase of their life forget big chunks of what they went through and like even some of the personal stuff that they went through during training?
Absolutely. And that is a trauma response. So especially people who've gone through toxic programs or who are particularly sensitive or trauma susceptible, because if you think of trauma, it has nothing to do with the external thing. It has nothing to do with, like, if you think, for example, being hit in the head. Like the trauma isn't the hit to the head, it's what happens internally. It's the shearing force, and what that does, it's the coup counter coup contusion that you get. That's the trauma. It's the internal response to it, and everybody's different depending on their lived experiences, their childhood experiences, in how they interpret trauma. So one sentence from a senior, like a chief or an attending, can mean nothing to one person. Being pimped can mean nothing to one medical student, but to another, it can be extremely traumatic. And the more traumatizing something is, the more we compartmentalize it and almost lose memory of it. And it can feel like it was a dream or like it didn't happen.
Everybody goes through stress in their life. I think that any like working woman, any mother, anyone in medicine, anyone particularly in surgery, and then you compound all those things. Like both of us have experienced like being working women with small children and doing surgery, which is like, it just feels like layer on layer stress wise. Can you talk about some of the healthy coping mechanisms that either you coach people towards or that they come up with on their own?
Absolutely. And one of the biggest skills that I think everyone needs to learn right away is relational skills. And we're working with my group right now in learning these, and I'll offer three that are really simple, like three levels of relational skills that people can start to use right away depending on their capacity. And that's the biggest thing, is like knowing your capacity. When we are at really low capacity, like we are overworked, we're post call, we come home and like we have to play mom and we just don't have anything left within us, we're not going to pick up tool 3 or tool 2. We're going to pick up tool 1. And so, for example, the first tool is empathetic listening, and that's different than feeling what someone feels. What you want to arrive at with empathetic listening is just, I follow. So it's kind of like having an experiential conversation. So if you are talking to your kid and they want to, they're going off on some story that you don't really want to listen to because you have a million things to do. You just want to give them your presence to the point that you're going to arrive at, I follow you. Or you're having a conversation with leadership and you're having a conversation with an unhappy patient and you are starting to feel triggered in fight or flight because you know there's some discourse happening, or you know the patient is judging you, or you're starting to think, oh my God, I hurt this patient, and they're telling you about their horrible post-op course, for example. Instead of buying into that fight or flight response, or that place where you're judging or cutting yourself off or disconnecting, like say leadership is saying like, actually, we need you to do XYZ, and you don't want to, and you're like, oh God, I have to say no. Before you do any of that, try to get into this relational tool of empathetic listening where you're like, can I just follow this person? All I have to do is follow. I just need to listen to them until I'm following them. And if you have the capacity, the next relational tool would be to loop for understanding. So this means that when someone has something to say to you, whether it's your kid, an unhappy patient, or leadership, anybody you're talking to, and you listen to them, you arrive at I follow, and then you summarize in your own words and you say, did I get that right? So let's say a patient comes in after a horrible post-op experience and they're telling you how they were in the ER for 12 hours and it was horrible and everybody was awful to them and they didn't get any sleep and they're in so much pain. Before your brain starts to go off down a rabbit hole about what that means for you, it's important for you to just kind of sit there with them and say, okay, so what I'm hearing is that you had a really horrible experience in the ER and they didn't listen to your concerns and they didn't give you the treatment that you think you needed. Am I getting that right? And then they're going to say yes. Or if leadership is asking something from you and you're saying, okay, so you're not willing to hire locums because you think it will cost more. So you want me to take extra call. Am I hearing you right? So that you're just basically repeating what they say just so you can understand them. And that is so connecting with a human being. Like you're so present that you're internalizing it, you're interpreting it, and then you're telling them what your interpretation is, and then asking them for their clarification. That is one of the most connecting relational tools you can possibly use. And so that would be the next level if you have the capacity. Or, you know, like with your kid, you can say like, oh, so you and like Evelyn played Roblox and so she did this in Dandy's world and then you did this and you got this little character. Is that right? And like your kid's going to be like, oh my God, like you're listening. So it's just so connecting.
Yeah. Thanks, Mom. You're really engaging with me.
Yeah, exactly.
Okay. So what's the third tool? If we've got the capacity to do 1, 2, and we have a little bit more.
Yes. And so the third tool is having internal congruency. And this is really relating with self. The first two are relating with others. The last one is relating with self. And so that's recognizing what your truth is in a moment. So let's say you're having a conversation with your kid about Roblox and internally you're like, I would rather stab my eyes out than have this conversation. I don't want to talk about Roblox. Like, I don't want to be here. This is awful. It's you acknowledging and validating that as your truth. I don't want to have this discourse with leadership. I don't want to talk to this patient. This is so uncomfortable having to talk to this patient about their horrible post-op course after my surgery. So that's acknowledging and validating your internal truth without trying to change it, but without ignoring it or pretending like it's different or pretending like you're too mature and you shouldn't be thinking that way, or just any pretending. You're just acknowledging and validating and you're there with it. And you're in that watcher space where you're like, okay, I hate every second of this. I don't want to be in this meeting. I want to be anywhere else. I don't want to be on call in the OR tonight. I want to be asleep. And you're just recognizing it and sitting with it and being okay with it in your truth, which is very unusual because in our society, we're so acculturated to pretend. Like we literally sit at meetings and people are like, oh, are you comfortable? And you're in an uncomfortable chair and you're just like, yeah, I'm totally comfortable. But really your internal truth is, I don't want to be here. This chair is super uncomfortable. I hate every second of this. This could be an email. And nobody says truth. So it's like, we are just so used to just lying to each other, to people please. And so this is undoing that internally with yourself. You're relating with yourself in truth, where you're saying, I don't want to be here. I don't want to have this conversation, but I am going to have this conversation because it's an important conversation to have.
Yeah, I think that's so practical. Like all those tips are great. The number one thing that happens like day to day in our practice is people come in post-op day 1 and they're like, I feel horrible. And I instantly get defensive deep down in my chest. I'm like, well, yeah, duh. Like you just had surgery. I did like a 6-hour case on you. I told you you weren't going to sleep. I told you you were going to be in pain. Have you taken the pain meds? Like these are all the things that start like fluttering through my head. But the 3 tools you just gave me, it's like gives me moment to pause. And what I'm doing, obviously I don't say those things to patients, but it just makes me feel icky. And so if I'm able to take those specific things, it just makes for a lighter, more relaxed, better connection with the patient for sure.
Yeah. Yeah. And it's fun to go out and try and to model this, because once we go out into the world and do this, we will model for other people how to be. It's fascinating. And I was talking to a client about long turnover time and how the leadership in her institution are telling her that, hey, you have to get the scrub techs and the circulators to move faster, to turn the rooms over quicker. And most people's response to that is okay, to try and rally them and say like, hey guys, come on, let's go. We got to turn over faster, and like talk at them. But what I offered to her is that every institution has this, every hospital has this. And my response to that was, I was putting EKG leads on. I'm taking all the scrub stuff off and I'm unplugging the microdebrider. I'm unplugging the suction. I'm over here like helping cleaning things up. I'm not saying anything to anyone. I'm tying people's gowns, but I am doing everyone's job and making their lives easier. And by doing that, I'm modeling for them like, hey, get your ass in gear. Like, we're not fucking around here. Like, we're all here to work. Let's fucking work. Everybody's like, okay, like she means business. Like she is not lazy. I will model what she's doing. And it's almost like when you show them how to be, that invites other people to kind of go along with you. And that's the same with these relational tools. So if you use them at work, if you use them with your kids, people will say like, oh, okay, now I understand like how relating is. I can see how that works. It's nice to hear it kind of like taught like I am here, but it works just as well to model it for others, and they will go along with you on that journey.
Mel, we've talked about kind of the different conversations that humans have with one another. Can you break down those 4 different types for us?
Yeah. So the different types of discussions that humans tend to have, and it comes from this book called Super Communication from Charles Duhigg. He also has a TEDx talk, which is really great. And he uses the example of a urologist trying to talk to his cancer patients. And I'll give that example first, just to understand kind of why this is important. And in this example of this urologist, the urologist was trying to tell these men with prostate cancer, you can watch and wait. The data suggests you do not need surgery. And what he assumed was these people would say, all of his patients would be jumping for joy, like, amazing. I don't need to have surgery where I could risk incontinence and impotence, like amazing. But what they did was they went home confused and talked to their family and came back and said, I need you to take this cancer out of me, like operate on me tomorrow. Like, what's going on? And they did not hear the fact that they are more likely to die with this cancer, and that a lot of prostate cancers are over operated. A lot of prostatectomies are overdone and unnecessarily. And so he was like, how do I fix this? And so he recognized there's something wrong with me and how I communicate. He noticed that he was trying to have a practical conversation with these patients. He was talking data. Practical conversations are dry. They're data driven. There's no emotion. And that is what a lot of surgeons, physicians want to have. We just want to get to the practicalities. Like, what's the decision? What we're trying to answer is, what's the solution? What's the next step? We're trying to get to a decision. We only have a little bit of time. So get all of the fluff. Yeah, efficiency. Exactly. But when you do that, you actually waste time and you become inefficient because you're not having a successful communication. And so in this book, what he talks about is how there's this really cool experiment, which I won't get into the weeds of, but that shows that you have a much more successful communication when you mirror, when you neurologically match the person's communication type. And so in this example, the patient with prostate cancer is wanting to have an emotional conversation while the physician was wanting to have a practical conversation, and they weren't matching. And so it was ineffective and nobody heard anything. And that wastes everyone's time. And so what the doctor did was he recognized, okay, they're wanting to have an emotional conversation first. And so when he would diagnose them with prostate cancer, he would say, what does a cancer diagnosis mean to you? Which is such a ninja question to just get the patient to open up about everything they're feeling and thinking. And that would lead them down the path of, oh, well, my grandfather died of cancer, or my neighbor's uncle died of cancer. And I'm this, I'm 70 years old and I'm terrified that I'm going to leave all of this debt to my family. And now they're just spilling their guts about all of their fears. And once you get past that, that's when you can invite them and say like, hey, okay, after you're having this conversation and you parse all that out, are you ready to hear about your options for how to manage this? Now they're ready to receive the practicalities. And so you've invited them and you've gotten their buy-in to talk about the practical conversation. What he noticed was that he was able to actually convey the data to these patients so much easier if he would just match them with the emotional conversation and then usher them into the practical conversation. And so he was so much more efficient, so much more effective. And so those are two types of conversations. We just talked about the experiential conversation, which is wanting to understand. So the emotional conversation is you're just trying to answer the question, like, what are you feeling? What am I feeling? And the goal is empathy. With the practical conversation, you're trying to get to a decision and you're like, what's the solution? With the experiential conversation, you're trying to understand what happened and you're arriving at, I understand what happened to you. I get it. I went on your journey with you. And so patients often want to take us on those journeys, especially new patients or patients who have like crazy postdoc courses. This is so common. And so getting into, okay, I just need to follow you is such a beautiful place. And it's so simple. If you're like, oh, I don't have to be distracted by my own fears. I just need to follow them. That's the most efficient, most effective way to connect with them. And then the last type of conversation, the fourth type, which is the most common that we all have, is the social conversation, which is just talking about where we are in the world, like who is what, like whose role is what. And that's all of the gossip, all of the politics, office politics. That's like when you're chitty chatting at work with all of your friends and you're talking about like who Taylor Swift is dating, like that's social conversation. And that's what most people want to enter in. That's 70% of human conversations. So it's, if, you might have a patient who comes in and they're just like talking about the local sports team, or you're like, hey, you're from Greece. That's so interesting. What was that like? And they want to tell you about their family. These are all just social conversations that are also really important and can't be glossed over to get to the practical conversation, because you're going to miss that opportunity to match with someone. And when you match with them and you mirror them, you connect with them, and that builds trust. And now you've saved yourself a ton of time.
Okay, we've talked about some healthy coping mechanisms. I want to get back into the dark, juicy stuff, Mel. What are some, without obviously naming anybody, as a surgeon coach, what are some of the more destructive habits that surgeons develop, utilize, and have to kind of work through? Talk to us about some of those things that you help people kind of overcome, and different techniques to change their habits.
Yeah, I mean, anything that gives you a dopamine hit. So it's any addiction. Everybody has addiction. Gabor Mate talks about this. He did research with heroin addicts, and he talks about how heroin addicts are no different than people who are addicted to something other than heroin. So like Gabor Mate has an addiction to classical music. He's like he spends an inordinate amount of money on classical music, but everyone has their pain point. Everyone has their thing. It could be shopping. It could be expensive vacations is a big one, like living from vacation to vacation. Alcohol, eating, all of these things are just ways to not feel and to numb out. So social media is a huge one, like scrolling on socials just like mindlessly. Anytime where you are not willing to feel something and you are disappearing, and in order to feel better because you're trying to escape your reality, whatever that means for someone, that is typically not a healthy coping mechanism. It depends on what the result is. So like you could also use the example of exercise. Like exercise was a huge coping mechanism for me, but it's healthy when it's not an obsession and when it's not to the point of, I'm hurting myself, I'm injuring myself, or to the point of anorexia. I have a colleague who actually had an exercise addiction. And so it's like looking at the result you're creating. If it's hurting you, if you're creating a result where you are, injuring your relationships, you are hurting your relationships, you are not able to function, or your health is harmed, then definitely it's something that needs to be looked at. But also normalizing and understanding that it's just a part of the human condition. Like we're always trying to find the dopamine hit, and we're surrounded by all of these different outlets. But the question becomes, instead of judging yourself, the question becomes why? Like, what am I escaping from? And what am I not wanting to look at in my life? What am I not willing to feel? And when you get to a point, when clients get to a point where they're willing to feel any feeling, it's usually a feeling like humiliation or shame or anxiety. But if you're willing to feel all of the feelings, then you have nothing to hide from. And so it's like learning to feel feelings is what it is what most people just need to learn. It's a skill where you just recognize what the feeling is. I notice where it is in your body. A feeling is just a vibration in your body, and then letting it be there without wanting to change it. And then getting introspective and looking at the thoughts underneath that feeling without buying into them. Because we all have thoughts in our brain that the majority of us have really awful self-talk, and 80% or more of the thoughts that we have are negative toward ourselves. So if you look and take a peek inside your own brain, you'll notice that you're usually saying something really horrible about yourself, or you're judging yourself. And if you walk it all the way back, a lot of people have some common themed like fear, which is often rooted in I'm going to be abandoned, or I don't belong, or everybody's going to leave me. That's usually kind of like the common human fear, is that I'm going to be left alone, like on a frozen tundra, and nobody's going to be around me, and nobody loves me, and I'm unworthy, and I'm broken, and everything kind of goes down to that. And so it's like taking away all the layers to get down to that, and having compassion for that inner part that you've been trying to like hide with all of the dopamine seeking behaviors.
Yeah. I started with you as a coach, and I don't know if we've really talked about this, but I was in like a really deep mindset personally for some stuff, and I had met with several other like therapists, and I was trying to develop some better coping mechanisms for this like deep, dark place I was in. And it just like, no one was like fitting. Like, I just didn't feel like we were communicating very well. They like didn't get it, but I couldn't really put into words. And then, we happened to cross paths through the Hippocratic Collective. And I thought, well, let's just give it a whirl. We've got a lot in common. She's a little bit older than me, but she gets like the whole like surgeon mom stress. Obviously, my personal thing is tangential to work, not directly related. And you gave me like the best analogy. Rather than trying to just get over something, you were like, no, you need to feel it. Like, you have to feel all of what you're feeling and listen to your self-talk. And I'm like a very visual person. And you were like, you're at the bottom of a well. Like, you're sitting there all alone, like on the dirt floor. And right now you're trying to crawl out, and you're not going to crawl out. Like, you just need to like stop. You just sit down. You need to feel the dirt. You need to just basically just relax and stop trying to fix things. And that has been like the single most helpful thing that you have helped me with.
Yeah. And it's, what you're speaking to is finding sufficiency, which is something that is a common theme. And a lot of surgeons don't understand what that means. And like, as you're talking, like, that's a great metaphor, is like being at the bottom of a hole and just being there and recognizing I'm safe here. Like, no one's attacking me. my body isn't being threatened. I'm not being threatened by anyone. I can just be here. And then being willing to be there as long as you need to be. A really good analogy for that is also like weight loss. So if you take someone who wants to lose 100 pounds, they're 100 pounds overweight, they are not comfortable in their body, they hate being in their body, they hate their body. They're never going to lose weight if they stay there. Like they have to find sufficiency, and they might not get to a place of, I love my body, I love my 300-pound body, but they can get to a place of, I have a body. This body is doing what I need it to do. I get up in the morning. That's worth celebrating. I can shower. That's amazing. I can walk. I'm ambulatory. And once you get to the place where you're in sufficiency, you're just like, I have a body. Then you can start to take action to lose weight. If you're in resistance and you're like, I hate this 300-pound body, I hate it, that's when you start to try and cover up with like overeating. And it's like a vicious cycle. And so it's like the finding sufficiency is such a common theme everywhere, even in entrepreneurship, like finding sufficiency in wherever your business is, finding sufficiency in wherever your career is. It's kind of like being a trainee and looking at an attending and being like mad that you're not an attending yet. Instead, you're just like, no, I'm a second year. Like, I'm fine here. Like, let me just be sufficient where I am. This is part of my journey. It's just such a human thing to just want to like fast forward and to be impatient. But the work is to find the patience and the sufficiency and to tell yourself you're safe exactly where you are without changing a single thing, with everything being as it is, without fixing.
I would imagine you have a lot of intimate, vulnerable conversations as a surgeon coach. When clients first come to you, how do you start that process with them?
So they come at varying levels of distress. Some come from a place of really like emotional turmoil, and I cannot do this. This is not sustainable. I am not going to be able to continue in this career if this continues on. And they want to go from suffering to not suffering. And then I get people who are not suffering. They're just dissatisfied and they are not wanting to go to work anymore. They're like, I used to want to go to clinic and now I just don't. I used to enjoy the OR and now I don't. And I have everything I ever wanted, but I don't understand why I just feel unfulfilled. And so it's like, there's kind of two levels of getting from suffering to not suffering, and then from not suffering to diversification. And it's recognizing that you're never going to be satisfied. You're never going to be at the top of your mountain and like enjoying the fruits of your labor. You have to always have something going, some future focus and some creative outlet. And so diversification of identity is sometimes the goal for some clients, but for a lot of clients, it's getting out of imposter syndrome and self-limiting beliefs about themselves so that they can get to a place where they can do their job and they're not tearing themselves apart every second of the day and terrified of a patient complication or terrified of something going wrong and living in like perfectionism paralysis.
Diversification of self. Talk more about that.
Yeah, it's having diversification of self. The reason why it's so important is because if we can get to a point where we can just burn down our lives, where we're like, I'm not attached to this. You can set a match to this entire career and I am okay. Not to say that you have to leave, but showing yourself that success, financial success, comes from value that you create, and the value you create in the world comes from your brain. So you can have financial success in any industry. You just get to decide which one lights you up and you have desire and fascination for. But a lot of people think that, oh, I only have this one skill. I leave this training program with one discernible set of skills. I am no good outside of my niche. And if I'm not doing this, I'm nobody. And so they get so attached. And this is kind of like attachment is the root of all suffering. They become so attached to the surgeon identity. And the question is, what happens when something happens to your hand? Or what happens when, like Stephanie Pearson, you get kicked in the shoulder? Now your identity is ripped from you. Or even like Gita Pensa, where she had this horrible malpractice suit that she had to actually go through twice. She went through all of the litigation. She won, and then it was turned over and she had to go through it again. And so what do you do from that? How do you create something from that? These women were able to go through the grieving process and the death and the rebirth of an old identity to get to a new identity. And they're both very successful. But that whole process doesn't have to be as distressing if you're ready for it. Everyone's going to leave their job. You're going to retire. What if you retire? I think of some of the old, like dusty old dogs in the field who like are holding on to their career with like a white knuckle grip because they don't know what else to do with themselves. And so it's like, even when like you age out of surgery, if you have nothing left for you, what are you going to do? You're going to lose yourself. And so like, this is setting yourself up for success when you're like, I have all of these things. I'm so diversified. I can be an author. I can be a speaker. I can be a coach. I'm a musician. I am a podcaster. I'm an entrepreneur. I like sell things on Etsy, whatever you want to do. I'm a cook, whatever you enjoy. If you can monetize that and give value to people, that's how you monetize it. People will pay for your value. Then you are like setting yourself up for all of the success. And when you ultimately and inevitably leave your job, you're not going to go through like the tunnel of doom and despair like a lot of us do. It's like, that is optional. We don't have to do that.
Yeah. And what's interesting is I keep thinking back to training and like it's almost the opposite of diversification because you work so much as a surgical resident that you literally drop every other interest. So not only does it dehumanize you like from a personality perspective, but then just sheerly like objectively, you don't have time to like do all these other things. And I have to wonder, this is probably existential, but like, how do we change the training system to not strip us of like who we are and make us these like, I hate to say bad humans, but like, I don't know. What are your thoughts on that? Like, how do we, it sounds like some of the problems that we develop or challenges that we face as surgeons kind of are rooted in this like 5 to 7 years of our life of training.
Yeah, absolutely. I mean, it's what we've adopted as truth, and it's always holding truths lightly and not absorbing something and believing it to be the truth of the universe unless you really truly believe that. And like everything that I talk about is very much rooted in like Buddhism and like Eastern philosophy. And like these are things that have spanned centuries of humans and different cultures of humans. And so like to me, it feels like the truth of the universe. And so it's being very recognizing, I think we have to recognize that humans within a system have to start questioning instead of just adopting and accepting something that is just given to them as if it's a truth. Because where did it come from? It came from William Halstead's model of residency when men literally lived in the hospital and they were not able to get married. And now I talk to, clientele who are in their 50s, and they talk about how they made $19,000 a year as a resident at Harvard. And they were like, oh, but the BU residents or our BMC residents are making like 26. And they're like, oh, but you're Harvard. And so you have the opportunity to train at Harvard. And so that's why you're paid less. And so it's like all of these like stupid reasons that we're given to do things because it's tradition. And instead of accepting that, we can say like, wait, why is it this way? Because if we're overachieving people pleasers, we're always just going along to get along. And what I want to invite people into is to stop doing that and to start asking the why behind the thing. And if it's not a good reason, if it doesn't feel like the truth of the universe to you, to question it and to have healthy discourse and to not be afraid of conflict and to not accept it. If we all do that, eventually the system will change. It's just that the system has been delivered to a bunch of people who just accept it.
Yeah. And I think most surgical residents kind of know this like dark history of surgical training, but a lot of those quote unquote fathers of early surgical training were high on cocaine for a large portion of the time they were awake. It's something that the general public doesn't really know.
Yeah, cocaine for when they were functioning and then morphine to sleep. And so that is the model that has been handed down to us.
I mean, I never saw anyone snorting cocaine. I don't think anybody was, but certainly caffeine was like a crutch that was a stimulant.
Yeah. I mean, I think it was probably more accepted in Texas where I trained. And I trained in 2007 to 2012, but there was one guy, I can't remember his name, but he was in general surgery and he would carry a flask in his sock of liquor. And it was just like, yeah, he just had his flask with him, got him through his day.
What?
Yeah.
This was a widely known thing. Like no one
Yeah.
said anything.
Nope. And I don't know if it was like somebody before me or because I'm like trying to remember if it was a story. I don't think it was anybody actually knew, but I think it was like a story about one of the old doctors. But they used to smoke like in the ORs. We used to talk about that. Like they used to smoke all through the hospital, all kinds of things. All the trauma surgeons smoked that I worked with, all of them.
Cigarettes?
Cigarettes.
What?
Yeah.
I'd like forget that people smoke cigarettes.
I know.
So gross.
Yeah.
That is so wild. I do feel like our attendings were pretty vanilla where I trained. You know, like if, for instance, if we had like a big barbecue or like a welcome thing for the new residents, you always knew who was on call because they definitely were not drinking.
Mm-hmm. Yeah. No, I mean, I think I just came out of it at a different time and in a different place where a lot of stuff goes in Texas. Like you can do a lot of things that you can't do in the Midwest or the East.
That's wild. I'm curious on your thoughts, women versus men. Do you feel like the surgeon experience is different for the two genders?
Yeah, it's vastly different. And like I always want to be like very inclusive and I don't want to be someone who discriminates or arrives at generalizations, but from my experience, there's like such a divide between how women and men go through training and how they come out. Imposter syndrome is so common with women and it's really uncommon with men. Their confidence is not shattered by patients being unhappy or complications or even malpractice suits. Like they can separate their self-worth from a set of facts, whereas women tend to really intertwine their self-worth into how they are perceived. And so it's so interesting how that has become. And I think it's probably a lot of messaging and social conditioning that leads us there. There's even like this, there's an experiment I remember watching when I was a kid, or maybe I was like, I was in college or something. And they had these kids, it was a psychological experiment. They had like 6-year-olds and they were given a present in a room and the boys would open it and they would unwrap it and there would be like a pair of socks or something really uninteresting. And the boys would be like, what's going on here? Like, what is this? This is dumb. I don't want this. And then the girls would open up the gift and they would pull out the pair of socks and they go, oh, thank you. Like we're taught to just like people please and make sure everyone around us is happy from such a young age that I think it becomes more internalized for women and we extract ourselves more than anything in terms of like what we actually think and feel and how we perceive ourselves to be worthy, whereas men can find their worth and their confidence and separate that from a set of circumstances that might be threatening their identity or might threaten their profession. Like women make it mean like there's something wrong with me, like I am bad, and men are just like, oh, that patient was unhappy, but I would have done everything the same way. I did nothing wrong. It's so fascinating.
It makes me think about like infertility almost. Several of my good friends have dealt with that. And always it's like, what's wrong with me? And I'm like, there's nothing wrong with you. Like, this is just how the stars aligned for you in this universe. And yeah, that's interesting. What percentage of your clients are male versus female? I'm curious.
It's pretty down the middle, like half and half. Yeah. And like, if I had to say something to like all of the women listening, because I know most of your listenership is women, like if you can just arrive at the thought anytime your brain is harassing you, I am not broken. Like if you are going through something, an experience, You are not the only person who has gone through that. Somebody has gone through that exact same set of circumstances, that exact experience, and has gotten through it. And if they can do it, you can do it. And there's nothing wrong with you. Like that is maybe like the most healing thought, to recognize that we are not broken, that the world is always trying to show us how broken we are. At least we're making it mean that. As meaning making machines, we tend to make it mean that there's something wrong with us. And just the truth, like really absorbing the fact, like, I am not broken. I am a human. I'm a regular human, and I'm having the human experience. And it includes 50% negative shit and 50% positive shit. And so it's okay for me to be in like this shitty experience right now. This is part of the deal.
Also, I feel like if you are broken, you just pull out your katsugi pot, if I'm saying it
Yeah.
correctly, that you taught me, where it's this beautiful concept that you have this like broken pot or broken cup, and you weld it back together with these gorgeous gold, pieces of glue or plaster or whatever. And then that broken pot becomes whole again, and it's even more beautiful than it was once before.
Yeah. And that's like the superpower, I think, of imposter syndrome, is that when you go through something like that, where you have to challenge your self-concept and you come out of it on top and you grow and evolve from it, now you have that skill. Now you become the person who can do that. Just like Stephanie Pearson is now the person when her identity is threatened, she knows how to reinvent herself. If you're never going through life being challenged, if you're just always like in your confidence and you think like you're pissing excellence all day and there's nothing wrong with you, like you're never going to have the opportunity to evolve yourself. And so that's why I think women are actually like sneaky superhumans, because we have all of these opportunities to evolve our self-concept. And if we can do it once, we can do it again, which is like the coolest thing.
I love that. All of us women, we're sneaky superheroes and we are not broken.
Exactly.
Mel, you are so busy. You do TED Talks, you have a podcast, you have an Empower Surgeons group. You're also a fellow co-founder of the Hippocratic Collective. Talk to us about some of your current ventures.
Yes. So Empowered Surgeon Group is so important for surgeons to be in. It is so good. Like everybody needs to be in this. And so if you can go to my website or go to courses.melthackercoaching.com/courses/empowered surgeon. If you're a surgeon, get in there. It is awesome. Like we meet every Wednesday, and just coming together and getting that infusion of coaching once a week is so fucking healing. It's just like the best thing ever. It's like you're going through your day, you're starting to like let things get to you. You don't really have a moment to self-coach. And then you get this infusion of just this energetic shift, and it is changing you. Like one of my clients was saying like, I just have so much more joy at work and I don't really understand why, but ever since I joined this group, like I feel so much better at work. And so it's like sneaky, it's subtle, it's ninja, how it changes your brain. And so that's one thing I think everybody needs to get into. And we're going to have a retreat in Cabo, January 9th to the 11th, which is going to be absolutely incredible. Frances May, myself, and then my like right-hand person, Steph Sheldon, who is a coach with 10 years of experience, will be there. And Steph and I will be running like a self-concept workshop for all of the participants, but we will also do a whale watching yacht trip. There'll be spa, massages, and facials. We'll all have dinner together. It's going to be really rejuvenating. And I want everyone to come out of that experience just completely changed. And I want them to have the tools to be able to coach themselves and manage themselves and make sure that anytime their self-concept is challenged, they have all of the tools that they need to kind of elevate themselves. I want them to be able to elevate themselves anytime they need. And other than that, yeah, I have a TEDx talk coming out. We have the podcast Surgeons with Purpose every Monday, and then a lot of things happening in the Hippocratic Collective.
Dr. Mel Thacker, a big thanks for coming on the show today, giving us some practical tips and tricks, mainly just the comfort of knowing that we're not alone in some of the struggles that we share every day. And then an even bigger thank you for being my own coach. It's really been life-changing.
Yeah, you're so welcome. It's such an honor.
Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com. Thanks for tuning into Fem MD, and remember, the world belongs to the women who question it.